Hello guys, welcome to our channel PKR Vibes Career and Growth. Today we are discussing about PR95 denial in medical billing. So your PR95 stating that plan procedures not followed. For PR95, what kind of pre-call analysis is required and what kind of questions we need to be asked over the phone call and what kind of end action we would like to take on this scenario we will discuss now. Okay guys, now we are discussing about PR95 scenario pre-call analysis. Now, pre-call analysis nothing but before calling insurance, we should have to do a basic analysis on a medical claim. For example, we submitted medical claim and we are not received any claim status from the insurance. Then, as a AR representative, you should have to check your internal sources. Internal sources are nothing but your internal doctor software, also called as a PMS, practice management system. And for example, you does not found any kind of information about the claim in your doctor software, then your alternate way is to check your clearinghouse. So for example, any electronic claims are submitted through clearinghouses. That is what we have to check, clearinghouses, for the claim status. Does we received any claim status from the insurance or not? For example, you does not find any information either in PMS or in clearinghouses, then your last alternate is to check in your respective payer portal. So in portal, if you have any access for that respective insurance portal, then you should have to check the claim status in that respective portal. For example, there is no information found in all internal sources, then we used to call to insurance for the claim status. For example, if already a denied EOB posted in your doctor software with the denial code PR95, and nothing but we got a received a response from the insurance is denied, there is a explanation of a benefits with the denial code PR95, then as a pre-call analysis you should have to verify the previous date of service payment history. For example, for the similar procedure, we got payments on previous date of services. With that reference of that claim, we can probe this information over the phone call and we should have to reprocess the claim. But how we will get this idea? Before you are checking previous payment history, you will not get this idea. So that is our job, is to verify the previous date of payment history. Fortunately, if you got any payments for the similar kind of procedures from the insurance, we should have to call and probe this same information, that for example we got previously payments, could you please reprocess. So in that way our pre-call analysis is become like a vital role in this scenario. And carefully examine all relevant health documents to ensure the necessary information. Sometimes what happen here, PR95 either might be related to service details or sometimes it is a like patient policy details. As per patient policy, this kind of services are not covered. So at that time, for example, we have to understand clearly why this denial comes, either patient policy or otherwise service details. Sometimes what happen, pre-authorization details, for example pre-certification is required. They are telling PR95, but in the remark code they are telling that there is a different scenarios will come. So we have to understand that carefully, we have to examine all relevant health documents to find out the exact reason for the denial. So that is what we should have to aware all those things, that we should have to verify carefully patient policy documents or details. Okay guys, now we are discussing about AR caller on call steps for PR95 scenario now. So for example, we are checking all internal sources like doctors software and internal clearing houses and also respective payer portal, and we does not found any claim information from our end, then our job is to call to insurance for the claim status. For example, how you can start your call, I would like to explain. For example, hi, this is Mike calling from provider's office checking on a claim status. So you should have to start your call like this, and you should have to ask the question. You are starting your call and also you are asking your question like, may I know the claim status please? So for example, you have to ask this question: if denied UOB is not found from our side. So we don't have any status from our end, and we are asking to the insurance representative for the claim status. Then our first question is, may I know the claim status please? Then the second point, here for example, here the situation I would scenario I would like to explain is, for example, claim is denied and the denied EOB received from the insurance stating PR95, and the denial was posted in our system. At the time, how can you start your call and ask your question is the next point. Here, your next question is, hi, this is Mike calling from provider's office checking on a denied clarification please. So you're starting your call and you're telling to the insurance representative that this call was denied, I mean this claim was denied, so could you please let me know the denied clarification. Yeah, the insurance representative reason might be not covered based on the insured non-compliance with policy or statutory conditions, or the reason, other reason might be the wrong procedure build. So we have to understand that there are a two three reasons might be come for this PR95 denial. Either might be denial related to the patient policy, or otherwise denial related to the service details. Here the reason number one is denial related to the service details, wrong procedure build. For example, we will get the reason one also, wrong procedure build. That's what our insurance is not giving any payments for this claim. The reason number two is related to patient policy condition. As per patient policy condition, these services are not covered based on the insured's non-compliance with the policy. So that is the denied reason. The next question is, may I know the claims appeals details? So as a AR representative, you should ask the question to the insurance representative like this: may I know the claims appeals details please? Because sometimes what happen, insurance is telling that non-covered, but that might be go for correct as per the patient policy. At the time, what is the option we have? We can go for appeal this claim. So at the time we can have to get this appeal details. So that's why the question is, may I know the appeals details please? Here the insurance representative will provide like appeals mailing address, fax number, and appeals timely filing limit, and also get corrected claim details. Because sometimes what happen, for example, scenario one, reason one, wrong procedure build. At the time we are tasking this claim to coding team assistance for a correct procedure. At the time coding team will change the uh, procedures accordingly and submit a corrected claims. At the time we want corrected claim timely filing limit and corrected claim mailing address also. So that's what we should have to take the corrected claim details over the phone call. That is the next point. So here that coming to next point, for example, if previous date of services or future date of services got payments for the similar kind of procedures from the similar insurance, then as a AR caller you should have to analyze this information as a pre-call analysis, right? So as a AR caller you should have to probe like this: hi, hi, this is Mike, we observed that on previous date of services, with the reference of this claim number of previously we got a payments, could you please reprocess the claim back for review? So here you are telling to insurance rep that we got a payments and previously, could you please reprocess the claim back for I mean could you please send back for reprocessing? So for example, if rep is verified, insurance rep is verified over the phone call and rep agreed with your points, then insurance representative will review and reprocess your claim. And also insurance representative will provide the turnaround time to process your claim, reprocessed claim. Then you should have to take what is the tat for that. Then if they are telling like 30 business days, then you can take the call reference number and close the claim. And here the last points, may I get the tat for yes, I already discussed it. May I get the tat for reprocessing? For example, EOB not available, then take the claim number. For example, EOB is available, it is a denied, claim number is not required, then take the call reference number and close the claim. Close the call. Guys, now we are discussing about PR95 scenario end actions. Now here the first end action is you should have to reprocess the claim. So whenever we got a payments on previous claim or future DAS, which is the similar kind of procedure, as a AR representative you should have to probe this information over the phone call, and you should have to request the claim back for reprocess over the phone call itself. In that case, the PR95 scenario will go for reprocess the claim. And the second point is you can task to coding. For example, you know, the claim is denied, PR95 denied. As per insurance representative, the denied reason was plan procedure was not valid or not correct or wrong. The procedure was wrong. At the time, as a AR representative, you should you should task this claim for coding assistance, coding review. So the coder medical billing, the medical coder will review your claim. If it is required, they will change the procedures based on medical records accordingly, and they will stated you like, okay, we are changing this procedure, can you send a uh, we already corrected this claim, could you please send a corrected claim. Then as a AR representative, based on coder notes, you can read and work accordingly. You should send a corrected claim. For example, sometimes what happen, coder will tell that whatever we coded initially, that was correct. At the time, by seeing that statement, you have to understand that whatever coded was correct. You can call and probe that whatever our coding was correct, could you please reprocess. Even though they are telling that we are not reprocess, at the time you can go for appeal. So but as a AR caller, if you are getting PR95 denial, and if you confirmed with the rep that claim was denied because of a wrong procedure, simply you can task to coding for better assistance. So that is the second end action on this PR95 denial. So here the one more action on PR95 denial is you can appeal the claim. For example, you are telling that, okay, this claim is not covered this kind of services based on the patient policy. At the time, for example, you felt that this was billed correctly, or your client is telling that whatever we build, or your supervisor is telling that whatever we build is correct, and you should have to appeal this claim along with the medical records, so are necessary documents. So we have to appeal this claim to appeals department, that whatever we have billed services, whatever our doctor given treatment to the patient is a valid or is a correct as per medical necessity. So could you please appeal the claim. So like this we can get a appeal this claim. Appeal is also one kind of end action on PR95 scenario. Guys, if you are not yet subscribed our channel, if you are watching our video first time, could you please subscribe our channel PKR Vibes Career and Growth, and turn on the notification and hit the bell icon so that you will get every our video as a notifications to you. And also, if you felt our content is useful, could you please like our video also, so that it will reach us many more needy people who are looking this kind of content. And again, thank you so much for your time. Have a good health. Bye for now.